Hi, I'm a former New York State Supreme Court Justice. Let me tell you about a very important issue that is confronting us this very day. Most recently, we heard and learned about 8 patients in a nursing home in Florida that were found dead. That creates an issue that we must discuss. Let me talk about the nursing home situation. It is a multi-billion, with a B, multi-billion dollar industry operated by big operators in the most cases. Big profits, big money involved, and patients, in many cases, are being abused in the nursing homes. I'm going to talk about a specific type of abuse. First of all, we have about 17,000 nursing homes in the United States and about 1.5 million patients in those homes. One type of abuse, in some states, for example, it's been found that 1 out of 10 suffer from this abuse by the nursing homes. It's called bed sores. It's a very serious situation. A bed sore leads to an ulcer of the skin, a breakdown of the skin. A breakdown of the skin will lead to an infection. An infection, if not properly treated, will lead to a sepsis, which is a systemic infection throughout the body. Now, when you're dealing with elderly people, their immune systems are compromised to begin with, and they can't fight off disease as people who have good immune systems can. And as a consequence, if there is a sepsis which develops from an original bed sore, that sepsis can ultimately, and the likelihood is will ultimately lead to death. Now, when we visit our loved ones in a nursing home, and I'm sure that many of us have friends, or we have relatives, or we have parents, or we have someone close to us in a nursing home, let's become the advocate. Let's see the patient and look at the patient and look at the patient's body and see whether or not there's any bed sore there. You have the right to do that. Ask questions. Be the advocate. Don't be intimidated by the nursing home staff or by the tech or by the doctor. There are bills of rights established by law, and you have the right as an advocate to insist that your questions are answered, and you have a right to insist that the patient is properly cared for. And if that doesn't happen, and if the patient suffers suffering and pain and disease and ultimately death as a consequence, then these nursing homes must be held accountable. Don't be afraid to be an advocate. You have the right to be an advocate, because the loved one who's lying there, usually elderly, cannot do it by himself or herself. They need you. They need someone to speak for them. They cannot speak for themselves. And if there's some wrongdoing and neglect by the nursing home, they must be held accountable by law. And when that accountability is there, then those who are doing what they should not be doing in injuring and damaging and abusing our loved ones will stop doing that, or they'll lose their license. But it depends upon you, depends upon all of us to see that the quality of care for those of our loved ones in nursing homes are good and within the standard of proper care. Let's be that advocate, and let's be there to make sure that our loved ones are protected. I will have more to say about this in later chats that we have. But in the meantime, this is the storyteller telling you to stay safe and keep out of danger.